So it's an exciting time to be a refractive surgeon, that we have so many amazing options that can be customized to each individual. We have over 10 different types of artificial lenses that can give people ranges of vision. And these are lenses that can do single focus, that can do multiple focus, that can be adjustable after the fact. And so in the preoperative appointment, when I'm talking with patients about RLE, I really am trying to understand how much of the day they're spending at distance, how much time they're spending at the computer, how they read, do they read on a tablet, do they read books, look at the features of the eye, how they're going about their life, what's important to them, do they do a lot of night driving, customize the RLE procedure, make a strong recommendation of the appropriate technology for them to help them achieve their best outcome.